To reverse type 2, what is the percentage range that our A1C should be in? Good question. We should talk a little bit about numbers.
Oh, yeah, A1C. Okay, you're shooting for 5.0. That's where you want to be. If you get to 4.8, awesome. If you're a 5.1, great. But you're shooting for 5.0. That would be the ideal place to be.
Hello, everyone. Welcome to the Fixed Blood Sugar webinar. We're back for another week where we talk all things type 2. So I'm excited that you guys are here. I have a new camera that I'm probably going to adjust mid-webinar here because I'm not used to it. So you're getting to see me up real close, but that's okay. Anyway, Joe won't be with us here today, but we are going to have a great webinar. We're going to talk about type 2 diabetes. And just like we do on all of our webinars, we're going to open it up to questions. So feel free to type those in the Q&A if you are on Zoom. If you're on Facebook, put those in the comments and I'm going to do my best to check those. Lots of emails have come in this week and lots of good things are happening with you guys. And so we're really excited about that. We are mostly focusing on the diabetes solution kit. And with that come a lot of questions. And so I have some of those in my email that we'll be asking Dr. Saunders today. And if you have things that come up, be sure to post those. We want to get to as many of those as possible. So let us know if you guys are on. We'll make sure the chat is working. Tell us where you're tuning in from. And if this is your first time, we would love to hear from you. So let us know, say hi, and we're excited to have you here. I think this is something really, really special that we have here. This webinar is amazing because you get to come on and not only be a part of the community that's here, but you get to ask Dr. Saunders questions for free, which he probably doesn't like.
You get what you pay for, right?
But he's passionate about this. This is what he does. And he is always helping people. And we're so thankful for him. So
always be wary of free advice.
No, in fact, that's what we're going to start with. We'll have you do a disclaimer if you don't mind, Dr. Saunders, but then tell us what you do and why this is of interest to you. Why is type 2 something of interest to you?
Okay. When Joe and I first met, we were talking about various illnesses. We talked about hypertension and kidney stones and all these other things that we were writing, or he'd already mostly written all of those books and I was just editing and helping out with them. And then this type 2 came up, this diabetes thing came up, and we started looking at that, and that became a big issue. And so we were sitting in a room in Arizona, in his condo in Arizona, and we were just a group of us sitting around. What are we going to do about this? And somebody said, well, nobody knows what causes it. And I'm like, of course we know what causes it. It's not that hard. And so I went up and I got on the board and I wrote it all out. And everybody's like wide-eyed going, oh my gosh, we do know what causes it. That's totally it. So then we made a whole video, and I flew to South Dakota in the wintertime without a coat, by the way. I just had this coat and that's all. And it was 11 degrees outside. And
you won't make that mistake again.
Yeah, and I did a talk on type 2 and what it was and what caused it and how to reverse it. And out of that talk, we said, well, let's write something a program that people can actually follow instead of just watching the talk and they don't know what to do about it. So then we wrote a program. And so that all followed one thing after another, because type 2 is something that's actually really, really simple. The cause of it is toxicity. And this has been a long time since we've actually talked about this, that your cells are completely closed off. Sugar can't get into your cells unless you have a receptor called an insulin receptor. And then you have this insulin receptor in your cell, and the insulin comes and unlocks it and lets the sugar in. And you might have thousands of them over one cell that are letting sugar in so that all of your processes can happen, so that they can make the energy be made into energy so that you can make your proteins, and the cell can function and do everything that it does. So once those cells, though, get full of sugar, they start making something called glycogen. And glycogen is like a starch. It's sugar, but it's like it connects all the sugars together and then stores it, like on shelves. You got inside the cell. Think of the closet full of shelves that are storing glycogen. And so when they need energy, they can just go in and grab some of that and take the sugars off and use that for energy. So once the storage is full of glycogen, then what you have left is the nucleus says, hey, we're full. We got all the sugar we need. In fact, we're going to get toxic if we take in any more. So the nucleus stops making insulin receptors. So now you have this cell with no insulin receptors. Why? Because it's got all the sugar it needs on the inside and doesn't need to bring any more sugar in. So then what happens is the insulin comes and there's nothing to bind to. So now the insulin level goes up. Well, there are a few cells in the body that don't block off the insulin receptors, and they're fat cells. Most of those cells are fat cells. So what happens? Well, all of the insulin, instead of going to your muscle cells and letting sugar into your muscle cells, it's all going to your fat cells and making you fat. You're just getting bigger and bigger and bigger. You're going, what the heck? I'm not eating anything. Why am I getting bigger? Well, it's because your insulin is high and you're insulin resistant, and the sugar can't get into your muscles, so it's being made into fat. And everything you eat is being made into fat. So even though I've had this a lot, people say, I don't eat anything. How can I be gaining weight? It's hormones. Your hormones do this. And insulin is a hormone. It's a peptide hormone that tells, it's the signal to your fat cells, make more fat. But it's also the signal to the rest of your cells, don't use sugar for energy, use fat for energy instead. So then, don't use fat for energy, store the fat. So that's why you're storing fat. Use sugar for energy instead. So then all the fat that you're eating gets into your blood and you can't use it for energy. So what happens? Your triglycerides go up. Triglycerides are the fat that you use for energy. So now you have high sugar, high triglycerides, high insulin. You're just toxic on everything. It's just too much of everything. So what has to happen? Well, all you need to do is, number one, use up the sugar that you have. Stop taking in all that extra sugar and triglycerides. So the program that we made was a really simple program to just stop the sugar from coming in. So what? Well, that makes the insulin level go down because if you don't have sugar, then you don't need insulin. Insulin is what brings the sugar into the cells. And then you start using up the glycogen, and then your nucleus starts making more insulin receptors so that the insulin becomes more sensitive. And then you don't have enough sugar around, so you start burning fat. So your fat cells decrease, they get smaller, and everything improves when you stop eating sugar. So that's what the program is. It's that easy. It's not that hard. And so we have how to do it, details, what's your motivation for doing it, and what medications are you taking, and all that kind of stuff. I had somebody call the other day, and they had ordered the book, and they're saying, I'm waiting for my book. And I said, what kind did you order? And he says, well, I just ordered the 19 whatever $1. And I said, you're not going to get a copy in the mail. You didn't order that one. That's the next level up. You have an electronic copy that you can look at right now and start reading it. He goes, oh, you mean I've been waiting for a week for it to come for nothing? I'm like, yeah. So just so that you know, the electronic version is immediate. You get an email, you click on it, you go right in, and your book is right there. What Leslie is showing you is if you order the extra, it's an extra $20 to get the book in the mail. So I don't want that to be. He was kind of confused about how that should come.
Yeah, so I did post a link, guys. It's bartonwebinar.com, where you can find a link to information about this free webinar, past webinars that we've done. You'll also find information for this diabetes solution kit and supplements, etc. But if you use code webinar25, you'll save 25%. And so it's a special code that was created just for people on the webinar. So most everything that we're talking about, like you said, is in this. Dr. Saunders, why do we do a disclaimer usually?
Because we don't want people thinking that I'm their doctor, that I'm giving them medical advice. Specifically, we're giving this for general information so that you can get an idea of how things work. And then hopefully you'll have like a good doctor or help or even on your own, figure out what part of that information applies to you. Because some people have a little bit of insulin, some people have a lot of insulin, some people have no insulin at all. And they're going to be very different in how they're going to handle the different things we talk about, like the medications and diet and all that kind of stuff.
We have a question here from Doyle. Great question. I have type 1. Will this program help?
Oh my gosh. Thank you so much, Doyle. This is a good way to do it. Why? Because if you do this program, then even with type 1, you will probably need less insulin, and all of the complications of diabetes happen because of high insulin. So if you're using less insulin, you are better off. So yes, the program is very helpful for that. For type 1, there's one other program that I would recommend, and it's kind of funny because it's almost the opposite. It's called the Mastering Diabetes Program, and that is a low-fat diet. So we have a very low carbohydrate diet, and they use a very low-fat diet, and you can't have any processed foods, and you eat low-fat. And because fat makes you resistant to insulin, and so in their program, they're going, okay, you're going to be able to eat sugar, carbohydrates, and they're eating 100 grams a day of carbohydrates, but they don't have any fat, so they're not resistant to the insulin that they use. So they use less insulin. So those are the two things that with type 1 that can be very useful.
Okay. Another question that I've been getting a lot of is, how important is exercise when you're trying to reverse type 2?
Oh, thank you. I almost skipped over that, didn't I? So we're talking about those cells that are just packed full of sugar. And there's two things we need to do. One is stop eating sugar, right? That makes sense. And then the next thing we need to do is use up all that extra sugar that's in the cells. And what does that mean? Well, to use up the glycogen, you need to exercise. And exercise is great for a lot of different reasons. One is it detoxes the cells from the sugar. And number two, it acts as insulin. So it allows your muscles to get energy from sugar without having to have insulin. So even if you're insulin resistant, even if you're or you don't make enough insulin, if you're type 1, for example, exercise is a great idea anyway.
What type of exercise do you recommend?
In all the research I've done on exercise, I think interval training is the best. And so, but I always tell people that ask me that the best exercise is the one you like to do. Because if you pick something that you don't like, you're not going to do it for very long. If I picked swimming, as soon as it got cold out, I wouldn't be swimming anymore. So that wouldn't be a good one for me to choose. Whereas I like running and I like bicycle, And I like, I'm actually taking boxing now with my son.
Are you really?
Yeah,
That's awesome.
yeah, it's fun. It's a good class, and CrossFit, and so I like doing other things besides swimming. So the one you like is the best exercise, but interval training is wonderful, and you don't need a long time. You could do like 10 minutes a day, and where you go all out for 10 seconds. And then 30 seconds of rest. And then you go all out for 10 seconds and 30 seconds of rest. We do that in our boxing class.
Very good. Okay, so I had some people on our team that wanted to hear your thoughts about our brand new supplement, berberine. And so I'm going to actually post a link for this in our chat. And can you talk to us a little bit about the benefits of berberine and why someone with type 2 might want to use this?
Okay, benefits of berberine. So we've looked at berberine for a while, and we were looking at how to use it and what to do with it. And berberine is like an amazing chemical. It comes out of the barberry plant, and actually there's actually other berberine is found in other plants as well, and you get some from your food, but it is something that is good for cancer. It's good for heart disease. It's good for diabetes type 2. It makes you more insulin sensitive. It lowers inflammation. So there are so many ways to use berberine that we decided not to put it in Cinechroma. Cinnamon is more specific to helping the insulin resistance and not anything else. So that was more of just for people with type 2. Berberine, on the other hand, was so broad, we didn't want to put it in a diabetes supplement. We wanted to be able to use it for a lot of different things because berberine is so useful. It's really amazing. Every time they study berberine, every time I look at research on berberine, they go, wow, it works for that. Oh, it works for that too. It's good for the prostate. It lowers inflammation. It's good for macular degeneration. Every time they study berberine, it's like, oh, it works for that too. It's almost one of those things that's so widely useful that it's almost like, well, gosh, everybody should just take it. But, you know, I've done a lot of research on vitamins and stuff over the years, and I come across periodically these studies that are done with the U-shaped curve. And we're gonna have a whole webinar on this at some point, maybe next week, or I don't know. They're all planned out. But at some point, we're going to have one on the U-shaped curve. And what that means is you get a benefit where you don't have enough, it's bad for you. And then you take some and it's great. And then you get too much and it's bad for you. That's the U-shaped curve. And so with berberine and most of the herbs, I guess, yeah, herbs, but even vitamins, most vitamins, even like with wormwood, for example, they actually did research on this, where if you take it every day, it stops working for malaria, for example. They use wormwood for getting rid of malaria parasites. But if they take it 5 days on, 2 days off, it continues to work because you have to take it long term in people where people have malaria endemic to their to where they live, to the mosquitoes where they live. So most at least herbs and most supplements, I would say that is a good way to look at it. That intermittently taking it is better than continuously taking it. Some things you need continuously, but even food, you know, we're just talking like today about type 2 diabetes and saying, well, you should go off sugar for a while to detox. Yeah, so if you do that intermittently, if you periodically take berberine, it's probably going to be better. I don't have any research on that. Don't quote me on that. That is just, I don't recommend that people take berberine every day for the rest of their lives. That's not what I would recommend.
Okay. Okay, so many questions are coming in. This is so good, guys. Thank you for all of these. I'm gonna try to get to some of these. Oh, someone asked how cold it is in Santa Barbara. Are you in Santa
Um,
Barbara?
yeah, it's about 69 degrees.
Okay. So that sounds lovely compared to what we have. We have snow here in South Dakota. It snowed yesterday. So, okay. All right. We got Robert on, and he has a new continuous glucose monitor, which we talked
Yay!
about lately. For like, how do we get our hands on these? We got to get these. Okay. He has the Freestyle Libra 3. It provides what's called a glucose management indicator, or GMI report. What are your thoughts on GMI?
I don't know what the basis of the GMI is.
Okay.
I don't I don't think that's as useful as the raw numbers. I know that I know it's an indicator of but it's I don't know enough to be able to speak on that. I think having your every 5-minute blood sugar and looking at the graph is more useful for our purposes because we're looking at okay, what did I eat that caused that spike in blood sugar? Oh, that was an orange. I better avoid oranges in the future, or that kind of thing is much more useful to us than general indicators. Sorry, I don't know.
Okay, that's good though. Ruth says, I've taken berberine 3 times a day for several years and it really helps the diabetes. My hemoglobin A1C is only 6.
Woohoo! But 6 is still on the pre-diabetes side. So we want to be clear that the program, the book is phase 1 is the way to get your blood sugar down, not taking berberine. So yes, we have berberine. It's available. It does help blood sugar. It's great. But on the other hand, the program is really the thing. The supplement is a help.
Yeah, that's probably one of the most common emails that I get is, can I take Synachroma to reverse my type 2 diabetes? And unfortunately, he just gave you the answer. So, okay. Connie is here today. Awesome. And Robert, how are you guys? I asked about type 1. Excuse me. Okay. My blood glucose seems to be very unpredictable, even though I have been vigilant in staying at the 20 grams of carbs for 6 weeks. This morning, it was 135. I've been off metformin for many weeks, but still take my insulin at night. Should I have done this the other way?
No, not necessarily. Yeah, that's a tough problem because if you have a lot of glycogen stored up, then you have to use up all those glycogen stores. And so for some people, it takes a lot longer to do that. And then you have to be careful what you're eating. If it's the carbs, if you're staying below 20 grams of carbohydrates, then it's likely that you're using some protein for energy as well, because protein is made into sugar. It'll keep your sugar up. And that comes from making glucagon. And then the glucagon tells the liver, make more sugar. So your liver is actually turning protein into sugar. And that's not a helpful thing. And in that case, the best way around that is we talked last time about lowering protein. And I looked it up. That's not very practical. The most practical way is to exercise. As you're exercising more, you stop using protein and start using more fat for energy.
Okay, good stuff. John says 20 years on max metformin on Synachroma and diabetes solution kit for 2 months. Big glucose reduction gains from AM 200 to 120 to 140 and about a 10-pound weight loss. Big thanks. Still following stage 1. Yeah, that's awesome. Great job, John. Still following stage 1 or phase 1. Can I add shrimp, cod, and other seafood on stage 1?
Yes, absolutely. Absolutely. Yeah, those are permitted, definitely. And
In fact, I think there's a really good recipe, a ceviche recipe, where Dr. Saunders has included, I can't remember exactly what fish you used, but it's in there. It's in the recipes. So check it out.
I like the shrimp. I like the shrimp
Like
and
shrimp.
whitefish.
Yum. Actually, I'm gonna have to make that soon. Good stuff. Okay, Aubrey is wondering what type of cinnamon we have in Cinnachroma. I have heard that cassia is more dangerous than, is it Ceylon or Ceylon? How are they pronouncing it?
Ceylon.
I don't know. I think I've heard both.
Yeah, cassia. So we've gone through these numbers a lot because, you're not the first one to bring it up, and people say, oh, it's dangerous because you can't mix it with Coumadin. Well, nobody takes Coumadin anymore, and so, well, I hope. But anyway, you can mix it with dicoumarol or whatever, because there's some dicoumarol in the cinnamon, but it turns out that it was a potential issue that people thought might be an issue, but it turns out that it's actually not an issue. So so they talk about, the dangers of cinnamon, and it turns out it's not an issue.
Interesting. Okay. We do have a question from Marcia. To reverse type 2, what is the percentage range that our A1C should be in? Good question. We should talk a little bit about numbers.
Oh, yeah. A1C. Okay. You're shooting for 5.0. That's where you want to be. If you get to 4.8, awesome. If you're a 5.1, great. But you're shooting for 5.0. That would be the ideal place to be.
Perfect. All right. I know I had some emails I need to read to you too here, but Don says, last winter I was diagnosed with diabetes and was prescribed metformin. First of all, is that the most common thing that people get prescribed?
Yeah, pretty much. Yeah.
And that's kind of I'm just going to ask this. When people go to the typical doctor, they find out they have type 2, what is the first thing that you were taught to do for that patient?
Oh, well, I was taught like over 30 years ago. So we used different things back then. we were using glipizide and glyburide and other things. But
yes, they're still around.
They're still around, yeah. So because metformin doesn't cause hypoglycemia like the other ones, like glipizide and glyburide can cause low blood sugar, the doctors are not too worried about prescribing metformin for pre-diabetics, that it's not going to cause hypoglycemic episodes. So it's pretty much, that's the first thing that everybody starts on. Even in pre-diabetes, is say, oh, you should start metformin. Women that have PCOS and get insulin resistance, even though they have normal blood sugar, they'll be started on metformin as well. So it's kind of common to just start with that.
I have seen in the news that there have been some celebrities that have requested drugs like metformin in order to help with weight loss. Is that a common side effect?
Yeah, it does help in a sense because it blocks your mitochondria from using sugar for energy, and it kind of forces the body to use fat for energy, so it increases the fat. Remember last time we talked about you should be burning 2/3 of your energy from fat and 1/3 from sugar. That's kind of an optimum place to be. And most people with type 2 are probably 2/3 sugar and 1/3 fat. So the metformin kind of reverses that, forces the body to burn more fat, so you're burning less sugar and more fat. And people who want to lose weight, that's a good thing to do. There's also a lot of people who are anti-aging people who are trying to live forever, are using metformin for the same reason, because it as you're burning more fat and less sugar, you have less damage to DNA, less oxygen-free radicals, and you age less. So it might
Would
be
you find
helpful.
some of those similar benefits in berberine?
Yes, yes. As a matter of fact, berberine does have a lot of those similar benefits. In fact, it's like the one that was on there that she said I've been taking it 3 times a day for years, and it's been keeping my blood sugar down. It keeps the blood sugar down in some ways better than metformin, and can replace metformin.
Wow. Okay, that's cool. All right. So Don, I kind of interrupted your question. I started and then I went off on a tangent. So I'm going to bring it back. Okay. So last winter, Don was diagnosed with diabetes and was prescribed metformin. In June, he developed leg pain and gradually could hardly walk. Does metformin cause arthritis? This week, the doctor confirmed I have arthritis in both hips. I can now barely walk because of the pain. Arthritis meds, nor Advil arthritis med helps.
Yeah. Okay. The answer is yes, it's possible. Metformin doesn't, that's not common, but it can cause muscle aches, muscle pains, even breakdown of muscles, can cause liver problems, and arthritis. So yeah, first thing to do is to go off the medication to see if you need it, or if it's causing the problem. If you go off it and all your symptoms resolve, then you know what the problem is.
Okay. In fact, I think we just had an email that went out that talked about muscle issues from metformin. So very interesting. I had an email come in from, let's see, Richard, and he was chatting with one of his coaches, Coach Avery, that works for Barton Publishing. And let's see, he said, let me start by saying that I'm not diabetic, but I have had acid reflux most of my life. My doctors put me on Nexium, esomeprazole.
Omeprazole.
Oh, I've heard that. Okay. It was just spelled a little different. All right. For over 25 years and was taking.
It's esomeprazole. Yeah. That's
okay.
Yeah.
And he was taking a 140 milligram capsule twice a day for the last 6 years. I've had bouts of acute pancreatitis twice in the last 2 years, and I've had numerous bouts of food poisoning and hospitalization. A few months ago, my doctor ordered a series of tests, including scans of my abdomen. One of the things that he found is that there are spots on my liver. I'm very concerned about my liver. My doctor blames my liver spots on drinking, but I'm not a heavy drinker. I think the damage to my liver comes from overuse of this
esomeprazole.
Esomeprazole. Right, I'm going to have to write down ESO. Okay, got it. My doctor usually performs an endoscopy annually, and the results are never good. My esophagus and stomach look pretty bad. Please forward my liver concerns over to Dr. Saunders to see what he thinks. He says, I don't trust Big Pharma anymore, and I will not get any jabs.
Okay.
I think Richard may be on the call today. So any thoughts?
Okay. Well, remember, this is general advice, not for you specifically, because I don't know all the details. But omeprazole, esomeprazole, Nexium is dangerous taken that long. So 6 years, that's a long time. So the best way to handle this is to find out the reason why. Because if you've been taking it 6 years and you still have bad endoscopies, if your endoscopies are still looking bad, like you have gastritis, then there's something else. There's something that's being missed here. So taking care of that's important. And the liver spots, yes, esomeprazole can do that. Pancreatitis, yes. Esomeprazole makes you deficient in magnesium, calcium, zinc, vitamin B12. So deficiencies can cause a lot of different issues with the liver, the pancreas, and digestion and absorption. So the answer is to look for the problem instead of just treating the symptom with the esomeprazole. That just treats a symptom. There's something else going on here. You might have histamine intolerance, for example. You might have gastritis for other reasons. And then if you're not dealing with the underlying problem, then the problem continues, and you add on all these other problems to it by taking the medication. So yes, people are selling, when they're selling something, they're going to say, well, these are all the benefits, and it really doesn't have any risks. So you have to look carefully and not look at just look at the sales pitch for the drug. Doctors are trained essentially by drug companies. All the money for medical training comes from drug companies, and so I have to take 65 hours of CME, continuing medical education, and I can go and get it for free if I want, and the drug companies all pay for it, or I can pay for it and get the secondhand stuff, which I usually do. So the doctors are trained by drug companies too. So they're just marketing essentially for the drug companies. So be careful of that and make sure you get the information that you need first.
All right. Thanks for asking. And I do see that Richard is on. So he said he's actually been on that drug for 25 years. Yeah.
Scary.
Yes. Okay. Susan said, I took metformin for 3 days and couldn't find my next word. I stopped using it right away and have been trying to help my type 2 diabetes naturally ever since. My A1C is 7.6 and I just started on Cinechroma with turmeric today.
Okay. So the key is, the answer to the question is no, don't take the metformin, don't take the Cinechroma. Well, you can take the Cinechroma. But remember, the Cinechroma is just to help you get enough nutrients, because I tested thousands of people and I saw that most of them, if they have type 2, are deficient in chromium, vanadium, selenium, vitamin D. So we put those in to Cinechroma in one. It's not one of those supplements like a multivitamin that has everything except the kitchen sink in it. And you see the diabetes supplements, they just throw everything in there, everything that is related to diabetes. No, this is just for the common deficiencies that people might have, so that they can use sugar normally. That's all it's for. It's not supposed to take the place of the phase 1 of the program. So really, it's not about the supplement. It's about doing the program.
Yes. And again, you guys, if you go to bartonwebinar.com, you will find the link to the Diabetes Solution Kit and use code webinar25. I'm going to quick ask this question again for Richard, who was asking about his liver. Can the liver be healed?
Yes. Yeah.
Yay.
Liver's one of those, like if you lose kidney, you're not going to get it back. Because that's filters. That's like trying to fix a coffee filter after you poked holes in it. No, you throw that one away and you get a new filter. Well, that's the problem with the kidneys, that you're not going to get kidney function back. And everybody with diabetes better be afraid for their kidneys fixed. Don't let them break down, because that doesn't return. The liver regenerates. And what's really cool about the liver, that's why people can drink and alcohol, they drink for years, and the liver just regenerates. Some people get cirrhosis, but interestingly, not that many. And then, like with liver transplants, they remove half of somebody's liver, give it to somebody else, and they both grow new livers. So yes, the liver can be fixed, it can regenerate, so you should be okay.
Good news. All right, Krish, welcome back. Let's see. The question is, why is my blood sugar in the fasting state in the morning high? It's come up almost every webinar. I have been strictly following the 610 reset during the past 6 weeks, and my fasting blood sugar measure ranges from 124 to 137. My question is whether you have seen an overwhelming number of patients in your clinical practice. If this is the case, does that mean measure of blood sugar in the fasting state is less important than compared to postprandial 2-hour after meal measure? Please clarify.
Okay. We care more, or we're using as our marker the fasting blood sugar. And the reason is because that's a better indicator of where your set point is. Okay, so we've talked a little bit about this before, but we have set points for everything. The temperature of our body has a set point. And if it cools down too much, then our brown fat has to pick it up, or else we'll shiver and shake. What is that shivering and shaking? Well, that's using muscles to generate some heat because you're getting too cold. And when you get too hot, you sweat like crazy. So the evaporating water will cool you down. So you stay at that set point all the time. Well, your blood sugar is the same way. Your blood sugar has a set point. Now, what if for years you've been a type 2 diabetic and you didn't know it, for example, and your set point is 200. So you have this 200 set point all the time. Or in Krish's case, like 130. Okay, let's say your set point is 130. Well, we want to get your set point down to between 70 and 90. Why? Well, because that protects your brain and your heart and your kidneys and your nervous system, so you don't get neuropathy, you don't have amputations. We want to prevent all of the damage that's being done by getting the set point down to a normal level. So if your set point is 130, then what happens if you drop below 130 is your pancreas puts out glucagon and says, make more sugar. So then you make more sugar and you go, dang, my fasting blood sugar is always right around 130. That's your set point. That's where we want to lower that down so that you're down in the 70 to 90 range. So then the next question is, well, how do you do that? That's what phase 1 is all about. Phase 1 is all about getting that set point down. And if that's not working well, then you may need to test for what's your insulin level, what's your C-peptide level. Are you making enough insulin? You just may not have enough insulin. Let's see. Yeah. There's other reasons, like some people are sensitive to protein and they start making a bunch of sugar out of their protein. But either way, if your fasting blood sugar is at 130, that's your set point. You need to get it down to 70 to 90 by doing phase 1 of the program.
Is this also what you would consider to be is it dawn phenomenon or dawn syndrome, when your numbers are lower, or high in the morning?
That could be. The dawn syndrome is a little different, and that is in the morning you put out a bunch of cortisol. Cortisol makes you resistant to insulin. More insulin resistance, again, it raises your blood sugar up a little bit. That's the dawn phenomenon.
I had a question in here where someone was asking, I'm not exactly sure if it's a question. It says, how about relying on the mainstream medical pills? And I'm not sure if that was a question or not, but what is the reason that most people want to get off of their traditional pharmaceutical drugs?
Well, there's a lot of good reasons. People often feel bad on the drugs. So the drugs inhibit, they block. So even metformin, we've had 2 people today say they've had problems with metformin. Why? Well, because it blocks the use of sugar for energy. And if you're blocking the use of sugar, well, your brain requires sugar. So if you're blocking the use of sugar, then you can get brain fog and problems with that. If the sugar's blocking your muscles, then you can get a lack of energy in the muscles and build up of lactic acid and that kind of thing. So the medications can cause side effects of lack of energy, of depression, of not being able to focus, of brain fog. A lot of people want to get off their medications because they feel bad on them. And one good reason why that may happen is most of the medications, except metformin we talked about, raise the insulin level to cause more toxicity to your cells. Remember, the cells are full of sugar. They're packed full. And if you raise the insulin level, then you're stuffing sugar into cells that all are already full of sugar. So you're making them more toxic and less able to function. So, those are the reasons I can think of why people would want to get off their medications.
Let's see. Rayanne says, I was given metformin, but couldn't handle it. So we have another one who's saying they couldn't handle it. Then I was put on Januvia, which I tolerated, but my insurance wouldn't pay for it as I didn't follow the procedure of metformin, 500, 1,000, and then 1,500 before I could try any other meds. That's something I've never even thought about, is what the insurance companies require you to do in order to switch. That's not even in my world. So
you got to jump through hoops.
Wow. And then she says Januvia was working for me, but I can't afford $1,500 a month. I'm still trying to find what works without me gaining weight and losing hair. Is that a common side effect?
Yeah, that's not uncommon too. So okay. What works is not to take medication and not to take pills and not to turn to like Synachroma or berberine to fix your problem. Really, it's to detox. Once you detox, then you're not going to gain weight. You're going to lose weight. So doing phase 1 is a reasonable detox to do to handle all your problems without having to spend $1,500 a month on medication, for heaven's sakes. That's woof. Yeah. And the book's only $20. It's not that much.
Don says, there are people who are in pain, and Don says turmeric supplements and tea does nothing for the pain. And so I think he's kind of saying, what do you do if you're not going to take any of these prescription meds? What do you do for the pain?
Well, just like any kind of pain you have, any symptom you have, always look for the cause. Why is it there? So sometimes pain, I had somebody come in today, she called earlier today and she said, my ear hurts. So I had her come in to look at her. She has what's called TMJ, temporomandibular joint. The problem isn't the ear. The ear is sensitive. The problem is in the jaw, actually. So if you don't know what the problem is, because if it was an ear problem, she might have an infection in there or something. And so if we did it over the phone, I'd say, oh, I don't know, you might have an ear infection. Maybe you should take an antibiotic. Well, that's not going to help the jaw pain, the TMJ. So knowing why you have the pain is the most important thing to know what to do about it. Because just treating pain with medications, drugs, or even treating pain with anything just to treat pain, if it doesn't take care of the underlying problem, then it could get worse.
Okay, I'm trying to find this message here from Gary. I believe he asked, what is a normal dose for metformin and what is considered a high dose?
Okay, well, it starts at 500 milligrams once a day, and that's because the way it works, it can cause intestinal problems. And so you start off on a low dose, take 500 milligrams once a day, and then 500 milligrams twice a day. And a normal dose would be around 1,000 milligrams twice a day. That's kind of an effective dose. Maximum dose would be 1,500 milligrams twice a day. So that's 3,000 milligrams a day. That's a high dose.
Okay. John says, I was taking vitamin B complex and magnesium to eliminate leg cramps in the middle of the night. Since starting with the Barton supplements, the leg cramps are now gone.
Wow.
That's awesome. So what are you taking, John? Let us know. I mean, what are you taking now? Are you using our magnesium, or are you saying you're using Synachroma, or what are you using? But that's awesome. Really good question here from Don. How do you identify nerve neuropathy? Does metformin cause neuropathy? Does diabetes cause neuropathy? My apology for the questions. I think you may have covered this before.
Oh, yes. We have a whole webinar on neuropathy. So what causes neuropathy is the lack of blood flow in the teeny tiny blood vessels, the arterioles, that are not feeding the nerves very well. They're not feeding anything very well. But the nerves are super sensitive to blood flow. If they're not getting enough energy, the nerves just stop working. And when they stop working, then you get numbness. So that's the neuropathy is a lack of blood flow. So the next question, okay, so there were a couple of questions associated with that. What was the cause of neuropathy? Does diabetes cause, does metformin cause neuropathy? Metformin might contribute to neuropathy because it inhibits the nerve cells from using sugar for energy, and nerve cells don't use fat for energy. Other cells can, like muscle cells, but nerve cells don't. So metformin can contribute to neuropathy. I don't know of any specific studies on that.
Okay. Okay, Pam says the new major disease is non-alcoholic fatty liver disease, of which my sister died from. This really frightens me, and I understand that diabetes and fatty liver are linked. This is why I'm here. Any thoughts on that?
Okay. Yes. Fatty liver is the cells of the liver are so or they get toxic and they die. And all of the energy, they store glycogen and all of that gets turned to fat. And so you start getting fat deposits in your liver because the cells are dying and they're not regenerating. And so it's a toxicity. You can get fatty liver from drinking alcohol. Every drop of alcohol is toxic to your liver. And so drinking large amounts kills enough cells that you're going to get fatty liver disease. That's the alcoholic fatty liver disease. So what she's talking about is non-alcoholic fatty liver disease, and that's the toxicity. It's metabolic toxicity, and it's mostly related to fructose. So we eat a lot of high fructose corn syrup in the American diet, but even like honey is half fructose, and table sugar is half fructose, and let's see, agave nectar and maple syrup. These are all fructose containing sugars, as well as a lot of fruit. If you look at what's in a mango has a lot of fructose in it, and fructose is sweeter than glucose. So it's a preferred sweetener because it's super sweet, but it's not used in the body like sugar. It is a sugar, but it's not used like sugar. It's used more like a fat, the way it goes into the mitochondria. And but it can cause damage. It causes glycolysis and glycolic acid elevations can happen from eating a lot of fructose, and that can cause damage to the liver. So the having too much sugar, especially fructose, would be a big one. Artificial sweeteners can affect the liver and cause fatty liver. Any kind of toxins, even if you're exposed to like cleaning fluid, carbon tetrachloride or other things that are ingested, the liver has to process toxins. And if it can't process them for whatever reason, you can start getting fatty liver. So the way to handle fatty liver disease is detox. And a pretty good detox for that would be the diabetes solution kit. If you do phase 1, you are detoxing the liver in a way. So, but the best detox is nothing at all. So I'm going to make a plug for fasting. The more you have an empty stomach, the healthier your liver will be. So how does that work? Well, however you can figure out how to have an empty stomach as much as possible. It's especially good to have an empty stomach at night when you go to bed. So eating breakfast, if you eat 1 meal a day, just eat breakfast. If you eat 2 meals a day, just eat breakfast and lunch. If you eat 3 meals a day, eat breakfast and lunch and then an early dinner. You still want to have an empty stomach when you go to bed. And fasting, long-term fast, you can lose about a pound a day. I had somebody who wanted to lose 30 pounds. I've had several people who wanted to lose 30 pounds, and they just fast for 30 days and drink only water Some of them drink, I've had somebody do a bone broth cleanse for 30 days where they just drink 16 ounces of bone broth twice a day. That's a great way. You don't have to do the diabetes solution kit if you do it that way. You can do fasting. That's a reasonable and good way to do that. Do some research first. There's plenty of good books and a lot of good research on websites on fasting and how to do it and how to do it right. And the fasting means an empty stomach, so you don't have to put extra things in your stomach. People think you have to eat little bits of food. That's not a good idea. Empty stomach, that's where you get all the benefits.
And we have several webinars where Dr. Saunders has talked about this. You'll see the 6-10 reset where you stop eating at 6, you're in bed by 10, and what the benefits of that are. So go to bartonwebinar.com. You'll find the link to the YouTube channel and search fasting. I have one more question that I'm going to ask you. We have another new supplement that we've talked about briefly, but it is our Healthy Heart Support Plus supplement. And it says that it has L-carnitine, it has beetroot, ashwagandha root, olive leaf extract, coenzyme Q10. Why would someone use Healthy Heart Support?
Okay, so we looked at how could we offer support for somebody who's trying to reverse heart disease or avoid heart disease. And so it turns out that as research is done, that stress is a huge factor. So we have a couple of interesting things there, like ashwagandha. Why do you put ashwagandha and olive leaf in, a heart? Will be a heart supplement because it helps to keep the adrenal glands, their adrenal adaptogens, to help prevent excessive amounts of cortisol, which can contribute and lead to heart disease. So it's kind of an unusual supplement as far as heart supplements go. The other things in there are the things that are generally missing from diet, or the things that we don't make enough of that prevent energy from being made in the heart. Things like CoQ10 and L-carnitine. And what those do is they allow you to make more mitochondria so you have better energy in your heart. And better energy means you're not going to get arrhythmias as easily, you won't get atrial fibrillation as easily, you won't get heart failure as easily. So it's part of having a healthy heart is having enough energy. So those are the two primary reasons for putting that kind of an unusual group of nutrients together.
This is so good, you guys. I'm telling you, I used to take all of these individual supplements, and then Barton just started making all of our own things. I just realized, I take coenzyme Q10 separately. Now I won't have to. It's in this. All these things just come together. So anyway, Dr. Saunders, thank you so much. This was a great webinar. We didn't even get through all the questions. So come back next week, you guys. Dr. Saunders will be here. I can't even remember what our topic will be for next week. In fact, it may get changed. So, but we always try to do whatever we are hearing from you guys. If you have a lot of questions about certain things, we change to those topics. So thank you again. Go see your patients and have a wonderful day, Dr. Saunders.
Bye.
Those of you hanging out, thank you again for hopping on. I am sorry that we didn't get to all the questions, but bring them back next week. Feel free to tell anyone about this webinar. They can register for it at bartonwebinar.com. We try to stick to type 2 stuff, but with type 2, and because it's becoming such a big deal now, many people are pre-diabetic. There are various other topics that come up, a lot of other illnesses and side effects and all of that kind of stuff. So bartonwebinar.com, again, send people there. That's kind of the hub where you'll find all the information about our webinars, supplements, links to our previous webinars that we have done. And again, we're so thankful for has just been really good for us, because it allows us to connect with you guys, see what your questions are, what kind of things you guys may need. And you guys are the ones that are fighting this. And so we're just thankful that we get to come alongside you and help you get through this. So that is it. We will see you guys soon, and have a wonderful week. Bye-bye.